Welcome to the Dr. Ardis Show. I am your host, Dr. Brian Ardis. Hello, Brighteon.tv fans. Let's throw out our sponsors. We're going to do something different in this 1-minute intro. We're going to show you mypillow.com. If you go to mypillow.com, use the promo code DOCTOR. You'll get 66% off, up to 66% off of anything you actually see there on their website. Support the Dr. Ardis Show. The NorthTexasHealingCenter.com is our other sponsor here for the Dr. Ardis Show. If you have symptoms, disease you've been diagnosed with, and you believe you can live symptom-free without the medications, the drugs, whatever you've been lied to about, go to NorthTexasHealingCenter.com and contact them today, and they can start you on the pathway to healing. All right, now let's go to BrighteonStore.com. Will be our next promotional sponsor for this 22-minute segment. Doctor is the promo code Mike Adams has given me, DOCTOR. You can save 5% off anything there. And then also for our advocacy group at GraithCare.com. GraithCare.com. Choose the AAA option if you'd like my personal input on your case of why it is you're sick or dealing with symptoms. GraithCare.com. Go there, use the promo code ARTIS. We're going to be right back. This is Heart Health Awareness Month. I've got the greatest, in my opinion, cardiologist in America, Dr. Thomas E. Levy, will be joining us for these two 20-minute segments. We'll be right back. All right, welcome to the show. I'm Dr. Ardis. I've got Dr. Thomas E. Levy in the house. February marks the Heart Health Awareness Month for our country. Thomas E. Levy, you've been on the show before. We're very proud of you and honored to have you here. I would like you to start out by, one, introducing all the books you've written and where they can go find them. And then we can dive into all the things that we have concerns about, want to educate, warn, and inspire people about, and give hope in relationship to natural substances that can provide relief, probably, and most published, that you've seen clinically around the world to improve the heart health of individuals around the world. Thomas, it's great to have you back, Doc. Say hi to the audience.
Howdy, folks. Glad to be here, Brian.
All right, introduce all your books. I want you to list them out in order, all the books you've written.
Wow. Okay. Let's see. There's Uninformed Consent that I wrote with Dr. Hal Huggins. Then Optimal Nutrition for Optimal Health. Then Curing the Incurable, Vitamin C, Infectious Diseases and Toxins. Then Stop America's Number One Killer. Primal Panacea. The Roots of Disease. Hidden Epidemic. Rapid Virus Recovery. Magnesium. Reversing Disease, Death by Calcium, and Hidden Epidemic. And I think there was one other little booklet that I wrote. I don't know if that amounted up to 13 or not, but that's what I got off the top of my head. They're all available at my website, peakenergy.com. And also, I'm going to be giving a workshop this coming Sunday that people can sign up for. And if they go to that website, there'll be a pop-up that they can see there. As getting more and more requests of, well, how do I do this? How do I treat this? If I want to do what you do, how do I do it? So I want to make the initial steps, Brian, toward establishing my protocols and getting the interested healthcare practitioners and physicians and docs and DOs, et cetera, that can treat patients to know what I recommend, and I can then start referring people around the country, because I just have so many folks that write me and say, well, do you have somebody that can treat me the way you were talking about? And the answer right now is, except for one or two docs that I know of for sure in the country, the answer is no.
Well, Dr. Levy, my audiences know what respect and admiration I have for you. I think you might have missed a book, or I actually have a title in my head that doesn't apply to your book. But is there one called The Toxic Tooth, or is that not a book? Did I make that up?
Yes, the Toxic Tooth. That was the one that predated Hidden Epidemic. Yes, sir.
Oh, there you go. All right. So that's great. I'm not going to have you spend the next 20 minutes like giving me a summary on all those, but all y'all should go buy them at peakenergy.com. And then for your Sunday event coming up this week, go to peakenergy.com and they can find information on how to sign up for that.
Right. The first thing that comes up right now on the website is a pop-up that will go toward enrolling in that event.
That's phenomenal. All right. So aside from the fact that we are aware that not everybody on the planet knows how to treat people the way that you're going to recommend, you're going to educate them on how to do that, which is phenomenal. Is this something that healthcare professionals should also be signing up for? Or is this really primarily for lay people to take information and go give it to their healthcare providers?
Well, it's for anybody, but it's actually primarily for healthcare practitioners. I want them to know my approaches, know why I do that. There's a lot of things that people just don't know the reasons for. And I think, as a as a doc, docs like to, at least they like to think that they understand why they're doing what they're doing. They don't just like taking something on complete faith. So a lot of the workshop goes into the science behind all of this, because it's not just stuff that got pulled out of thin air, and the fact that results are being achieved. We're getting significant resolution right now to a young lady who's had quite significant chest pain and shortness of breath a year and a half ago. So she's been suffering every day for a year and a half. And after about 2 weeks of treatment, she's pretty doggone close to normal.
That's awesome. What was her primary symptoms?
Chest pain, shortness of breath, severe fatigue, and just a total loss of lifestyle, I guess you could say.
The principles you're going to be presenting on Sunday, are they basically just surrounding effects and long haulers, or is it really just all tied together that there's basic principles you've studied, researched, published, and used clinically that also just simply need to be applied here in these situations? Or is it all brand new? I'm talking the injuries and how you recover these individuals from that. I'm assuming it's not all new. I'm assuming it's stuff and principles you've taken over your lifetime of experience over the last 40 years.
This body of work, if you will, has evolved over a long period of time, but it is designed to treat any condition out there, which might sound like a grandiose thing to talk about. But the point is all pathology at the cellular level is the same. And that is increased intracellular oxidative stress with high calcium levels, low magnesium levels, and low vitamin C levels. And so we go a lot into not only what vitamin C can do, but the fact that it's only when you get your vitamin C levels normal inside a cell that that cell once again becomes normal. And that obviously is the goal toward any effective therapy for any condition, is to take the cells, the tissue that's involved, and bring the intracellular metabolism inside the cell back to normal. And gosh, once you've done that, amazing things happen clinically.
Amen to that. All right. Well, I'm very excited to help promote it, help talk about it, get people aware of this. I would like as many healthcare professionals, lay people, even if they're invited, to participate in that event on Sunday. I'm very proud of you for doing that and taking the initiative to do that. It's been our attempt nonstop to provide real world evidence and truths that can be applied into your life simply to actually improve your overall experience of living. You know, that's what my goal is. All right. Sure. So give me some interesting stats that you've been aware of, been brought to the attention of in the realm of cardiovascular health in the most recent last 2 years that bother you, concern you, that people need to be aware of.
Well, the number one thing is myocarditis was, throughout the entire history of medicine up until the beginning of 2020 or shortly into 2020, an extremely rare condition. Now it's actually common. And of course, that relates to the article that I wrote on this, which is myocarditis, once rare, now common. So far and away, that's the most significant thing. Other heart conditions are also on the uprise during this period of, and it's both of those things too, because chronic COVID, at least in one regard, have similar underlying pathology because they have what I call a persistent spike protein syndrome, okay? And probably the ones that have it after a little sicker because it appears that they deliver a higher dose of the spike protein or a higher dose of RNA that goes ahead and programs and allows the production of spike protein. But ultimately, both syndromes relate to the amount and the persistence of the spike protein. So in that regard, then we're seeing a large number of things, not just myocarditis per se. We're also seeing anomalies, if you will, when the heart muscle gets inflamed, which is what myocarditis means, inflammation of heart muscle, secondary to the spike protein. For reasons unclear, the spike protein doesn't attack everything throughout the body equally and symmetrically. It does attack lots of different areas, but in any two people, it's not really the same. Now, in the case of the heart, you can sometimes have if you will, a generalized attack of spike protein on the receptors in the myocardial cells so that you have a diffuse heart-wide inflammation, but it can also be very focal. Now, when you have a big myocarditis, lots of cells involved, you have very high levels of troponin, which is a protein released when the heart is damaged and continues to be damaged and inflamed and heart cells dying. The thing is, though, is there's a lot of people out there, and we really don't have the numbers yet because people aren't getting tested, where the tiniest elevations of troponins are continuing to persist. And unlike other tests, your troponin level should never be abnormal. It should never indicate that you have an ongoing necrosis or death or inflammation of any heart cells at all. Obviously, the more it's worse. But we're also seeing, and they're just recently discovered in the literature, described in the literature, where not only can this inflammation be spotty in one area of the heart versus the other, it can also be selective to the conduction system of the heart. And this was one of the things we talked about with the U.S. Freedom Flyers group, is that the FAA changed the rules within a few months ago from the year before, saying that the normal prolongation of the initial part of the cardiac impulse, which is called the PR interval, has now declared to be okay or quote unquote normal if you allow it to increase by 50 to 60%. And in and of itself, it's not a major concern for most people, but when it's done, it directly indicates that the cardiac conduction system has been significantly and selectively attacked by the spike protein, regardless of where it comes from. And of course, the problem here is, even outside of the context of the pandemic, a prolonged PR interval has been shown statistically over time to have an increased chance of arrhythmia, heart block needing pacemaker, and early mortality. That was outside of the pandemic. So now we have within the pandemic and the spike protein increases in the PR intervals we never saw before. That is of major concern, not just for the pilots, but for the general public, because when you inflame conduction system cells in the heart, they're already electrically active. And when you inflame them more, they can get irritable, throw off extra beats, throw off an abnormal heart rhythm that can be inconsequential or it can be fatal. And it's no question in my mind that this is why so many young people, especially in sports, you see the reports almost every day now of young people on the football field, on the other areas, just dropping dead or collapsing and then later get resuscitated. But the problem is when these irritated, inflamed cells get an additional surge of adrenaline, which is what competitive athletics is all about, and which is also what a stressful cockpit is all about, you run a substantially high risk, then higher than ever we've had before, of precipitating these abnormal and potentially fatal heart rhythms. So yeah, we got a lot going on with the heart since the pandemic started, and especially now, late in where there's not so many people getting disease, but we're having lots and lots and lots of people getting, in my opinion, cumulative spike protein. Because to anyone who's had one, they've done fine. I say, great, count your blessings. But the point is unless you're checking these blood tests, the troponin level that I've talked about, and you know for sure it's absolutely normal, you can still have a focus in your heart, getting ready to just ignite in flames like gasoline on a fire when another big dose of spike protein comes into play, like with. So I advise anybody who's had and they feel fine, great, don't push your luck.
Very good. As a perspective from a cardiologist, 40-year board certified cardiologist, someone who's still continuing to publish literature, actually tell them where you can find your work that you do to publish research papers. Where can they find that?
Well, on my website, peakenergy.com, where we talked about earlier about the workshop, once you go on the website itself, they have an area that says articles, and there's a whole long series of articles I've written for the Orthomolecular Medicine News Service. I mean, I could give you their website too, but people get a little confused getting there. And if they just go to my website, they'll see those articles, and they'll also see the information that if they're interested in subscribing, no charge, of course, to the Orthomolecular Medicine News Service articles in the future, that's easy to do, but it's all very accessible on the website.
I like to learn. Thank you for giving that info out. I like to learn as my audiences learn. So, as a reminder, I would like you to explain to me as a cardiologist, when you see an increase in the PR interval, what part of the heart's contracting that they're measuring?
Well, the PR interval simply means the length of time from the beginning of the electrical spark that spreads across the atrium, the upper chambers, allows that to depolarize and propagate the impulse and finally get to what's called the atrioventricular node in the middle of the heart. The amount of time that takes is the PR interval. Now, when it takes longer than normal, it means that the conduction system is slowing. It means it's having a difficult time getting its way through the atrioventricular node. And when you start slowing heart rate, so slowing heart conduction times that should be a normal level, that in and of itself puts you into what's called different re-entry phenomenon, where you can generate abnormal heartbeats, abnormal heart rhythms. But the important thing is you need to get the impulse to the AV node, and that is where the heart really becomes amazing, because the AV node has these specialized conduction fibers where the moment it hits the AV node, then it rapidly goes to the whole heart so that all the heart muscles contract at the same time, and you get a synchronous, powerful heartbeat. Whereas if it just was cell to cell to cell, you'd get more of a writhing of the heart than an effective heartbeat. So that's one of the important reasons why conduction is so important. I mean, dysfunction, well, doesn't mean you have a terminal heart condition, but it means you have substantially less efficient heart function, and you're going to be more prone toward heart failure, more prone, as I said, to electrical arrhythmias, atrial fibrillation, and more prone to having and needing a pacemaker somewhere down the road because your heartbeat ends up getting too slow. So all of these things, and just the statistically speaking, an increased chance of death from all causes. So as I mentioned earlier, they are not inconsequential. In any one person, a prolonged PR interval is not statistically speaking going to give you a big chance of having major heart problems down the road. But when you start talking about a population of many thousands or hundreds of thousands of people with other cofactors that impinge on heart function, and when you have the situation like we mentioned with the pilots, where, you know, if you or I drop dead, it's just us. If the pilot drops dead, a lot more involved than just them. So we need to be not, as the FAA is doing, pushing the goalposts back and trying to make what was a 50-yard field goal now a 60-yard field goal, and just saying, but don't worry, we're going to call it a 50-yard field goal even if it goes 60 yards. I mean, the standards that EKGs, electrocardiograms, have been interpreted have been the same for over 100 years. And the FAA, to the best of my knowledge, is not a medical organization, much less an organization of internal medicine, much less an organization of cardiologists, because so many of the other subspecialties think they know how to interpret electrocardiograms. And I guarantee you, I've overread so many cardiograms read by non-cardiologists. It blows my mind as to how much information is missed, how much is looked over. So when you have anybody but the cardiologist defining or redefining parameters of normalcy, that should get you worried right there, especially when we know how terribly worried most governmental organizations are about the public welfare. So they're just taking their own bet that Well, probably no more. And we already have a shortage of pilots because we forced so many of them to get back. And so many of those are now sick. And so many of the other pilots took early retirement. Rather than get back, the pool of pilots is way, way down. And some of the major airlines have even made the FAA aware of the fact that they would like permission on some flights to have one pilot. That should scare the daylights out of anybody that might be flying.
Yeah, I was going to ask you, what was your feeling, or were you made aware that the FAA consulted cardiologists before they changed these recommendations? Had you heard that? Did you know it? And then how do you feel when an organization that's not a medical institution or organization is changing medical paradigms or parameters? I was just curious. You did a great job of explaining it there.
Unless you have any other thoughts. I don't know who they consulted or who they went with, or if they consulted anybody at all. But they have an array of docs that do their physicals and everything like that. And I certainly, obviously, they didn't make any concerted effort to clear this type of thing with any medical organization, not that I'm aware of. So this is dancing on dangerous territory, Brian. Very dangerous territory.
Dr. Levy, it actually makes me feel, and I want to get your interpretation here, it makes me feel like they're trying to normalize problems that could be enforced anyway. They know this is a side effect. They've seen it. It's been published. We're seeing it as a result. How odd is it? How odd about it? Yeah. How odd is it that they're also trying to normalize now, as you've noticed, I'm sure, that strokes in children is normal. Heart attacks in children are normal, and they advertise it on the side of buses, like all over cities. And I'm like, this is not normal. You just mentioned myocarditis was not normal until the last 2 or 3 years after these shots released on the planet. How shocking is it you see them trying to normalize cardiovascular diseases in young people and children? We have 40 seconds before the next one.
Not too much shocks me anymore. A lot disgusts me, a lot appalls me, but not much shocks me anymore. I just don't know. The whole concept, one question and one question only has to be asked and accurately and scientifically answered. And that is, will this, statistically speaking, prevent more harm than it causes? That's it. That's the only question you have to ask.
Amen to that.
But it's an important question, obviously. And balance it with other less objective factors, which is, just because it might, and I say might, I'm not acknowledging that it can, just because it might prevent a disease in a large number of people, how much damage does that disease do? In other words, how many people have just gotten COVID and then gotten myocarditis? And a number of them, but nothing along the lines of the ones that, so, and then of course we have the very dramatic data on the kids, where virtually statistically speaking, there's just no fatality at all from COVID among kids, the rarest of rare occurrences. Yet myocarditis from affecting very easily, and if it doesn't, it can controlly destroy the life of that child for as long as that child continues to live, whether it makes it to an adulthood or not. So how important is it to prevent, if you can, how prevent an infectious disease that you're going to get over anyway?
Amen to that.
And of course, very early on, what's the purpose of that? To prevent a disease. And they just swore on a stack of Bibles that they're going to prevent COVID. Well, guess what? Even the pro-vaxxers now have to acknowledge.
Welcome back to the Dr. Ardis Show. I'm your host, Dr. Brian Ardis, with the incredible Dr. Thomas E. Levy. Go buy all of his books. You listened to them out in the first actual segment. Let's get through our sponsors here so we can continue this conversation on heart health, as it relates to this February Heart Health Awareness Month, and of course, all the concerns we've had, published, unpublished, testimonies, all kinds of horrible effects to people after the COVID and dealing with heart complications. All right, so for this 22-minute segment, we're going to introduce our first sponsor, is KirkElliottPhD.com. We did a little video last week, and we talked about inflation, the attempts to try to destroy the money you've worked so hard to save over the last however many years you've been working. Kirk Elliott, PhD, 2-time PhD, will help you navigate those waters to protect all of the money you've tried to save over the last decades of your life. So go to Kirk Elliott, PhD for a free consult. And then our next sponsor is Grow Water Hydro Max. How about that? We'll do that one. GrowMaxWaterHydro.com. For those of you who are actually growing your own foods at home, please consider removing chlorine, fluoride, glyphosate from your water as you feed your attempt for organic vegetables at home. And then let's go to Hydro Shot. I start out every day with this nitric oxide infused hydrogen beverage. H2bev.com. Use the promo code DOCTOR. I subscribe to this. I actually drink one every morning to start my day, and so does my wife. 10% off there with the promo code DOCTOR, DOCTOR. And then we'll throw out drstellamd.com. I like her. She's a buddy of mine. We'll be together this weekend, actually in Sealy, Texas. There's going to be a press conference for another. Use the promo code DOCTOR there for anything that she's offering that we don't have already. All right, let's welcome Dr. Thomas E. Levy back to the platform. Remind the audiences again. What? Oh, hold up. We got one more sponsor. Never mind. We got one more that I'm not used to. Here we go. We're going to give a shout out to All American Air and Jeremy. Jeremy's a big-time fan of the Dr. Ardis show, and he actually professed unsolicited. All American Air is in Dallas, Texas. Reach out to them. You'll see the phone number on the screen, 972-415-7995. And he's decided to protect his children and himself from any unlisted, unpublished cardiovascular side effects of these. And you should too. Listen to Dr. Levy. Listen to me. We appreciate all you do there. Support All American Air. Thank you, Jeremy. All right. We got 17 minutes, Dr. Levy. I'm going to run through a few things here with our audiences that my producer, Christina's put together. Thank goodness. There's a few things we've recommended over the time. My number one since the period of speaking out against COVID was vitamin C. Now, you have published many, many things in relationship to vitamin C. I have quoted, shared, put even out your orthomolecular medicine article on vitamin C being used in China. I mean, it was reported there they were able to help almost save everybody's lives there in China in January of 2020. Anybody with this COVID pneumonia in hospitals, 100% of people went home in 5 days of high-dose vitamin C. That stuff was incredibly rewarding for me to be able to share that information with people around the world like I had been in practice for 20 years. But we're going to run through a few of these things here. Can you describe some of the benefits behind N-acetylcysteine and maybe correlate some of that to what we're seeing with cardiovascular effects post-COVID, long hauler COVID symptoms?
Well, N-acetylcysteine is a potent antioxidant, okay, and it's one of the building blocks for glutathione. I think most people know that glutathione is an important antioxidant inside the cells. And most of glutathione is not inside the cells because you consume glutathione and bring it into your cells. Rather, it comes from the synthesis of glutathione inside the cells. So the degree to which you can support that synthesis, which is supplying the precursors, and N-acetylcysteine is one of them, along with the other things that you can do to support an antioxidant environment inside the cell. I say that because the glutathione synthesizing enzymes are very susceptible to oxidation. And one of the signs that your cell is getting healthy is the fact that the glutathione levels start rising, which means the oxidative stress inside the cell is dropping, usually because you brought your calcium down and you pushed your magnesium levels up. But as I had mentioned earlier, when the smoke finally clears, what really is the one single marker of whether or not you've achieved normalcy in a given cell, which means, at least for that cell, there's no more pathology, there's no more disease, there's no more infection, and that is normal intracellular levels of vitamin C. So N-acetylcysteine contributes to this. Also, it's been very useful, perhaps through this glutathione mechanism, perhaps by its own antioxidant impact, is N-acetylcysteine in combination with bromelain, which is a enzyme derived from the pineapple stem or the pineapple plant, maybe the stem, I don't recall. is those two things together help dissolve spike protein inside the body. So these are important supplements. These are important functions to have in a supplement. And so, no, I have the only downside of N-acetylcysteine is, of course, it has a sort of a slightly rotten egg smell. So some people, you want to take it in capsules and swallow it. You don't want to really make a beverage out of it. But aside from that particular feature, N-acetylcysteine is an excellent supplement. And I got to say this, I mean, we're talking about supplements. There are thousands of supplements and easily hundreds that I can tell you are good for you, but you can't eat supplements all day long. Most people can't afford more than 30 or 40 or 50 bucks tops a month for their own unique array of supplements. So we always have to couch the utility of the supplement in one person versus their economy and whether or not they're getting some of the more basic supplements that we'll talk about. So there's very few supplements that I'm, shall we say, against, but everybody says, well, what about this? And what about this? And well, if you can afford it and you like it and you feel it helps you, take it.
Well, I'm going to actually just face the rest of this discussion. I'm going to actually throw out a few of these things that we have supported and I have promoted and talked about for the last 3 years as ways to answer some of the concerns we were seeing with COVID. For example, with NAC, it's one of the reasons why I decided to manufacture my own when supply chain issues were an issue, and the FDA originally in May of 2020 threatened to make sure supplement companies couldn't sell it anymore. If you remember that at the beginning of COVID.
Yes.
NAC has a published side effect of actually improving clotting outcomes in the blood. In fact, I've seen studies where they actually did intravenous NAC instead of using heparin and warfarin to stop blood clotting, and it worked just as good as those two anticoagulant drugs. To stop you when you're doing a surgery and you cut somebody open, the blood wants to clot to keep you from hemorrhaging. So they will use these anticoagulant drugs like warfarin and heparin to keep that from happening. And NAC by itself had the exact same effects. So in the published concerns that blood clotting was occurring with COVID as a side effect, and then this elevated D-dimer you've educated people on that we've been made aware of by Dr. Charles Hoff out of British Columbia, Canada, with 60% of his mRNA injected patients. He called it as a result of this. That's how they got their name. But the NAC was one of the reasons why I was recommending that this entire time was its benefits twofold. Glutathione, it is used to generate glutathione production, which is phenomenal. And then also the blood clotting benefits is why I was recommending it. And I just wanted to make sure as I talk about these things, does a 40-year board certified cardiologist have objections to those, in support of those, any warnings of those? So that's kind of what I'm going to do with this right now. Like you just mentioned NAC. My next question would be for you, just with this one. Is NAC something as a cardiologist you would recommend? This is truly for educational purposes for me. Is that something you would recommend to people that they, if they could afford it, wanted to afford it, should take for life, or only during periods where there's threats of blood clots?
If they can afford it, it's a good supplement to take indefinitely.
I take it every day.
I say this, though, bearing in mind that I look at vitamin C, magnesium, vitamin D, vitamin K2, a good B complex that has bioavailability and a good multimineral as the things that you should take if you can afford it. And if you have no problem affording it and taking something else, then I start adding these other agents. But I wouldn't favor usurping what I call the big four being vitamin C, vitamin D, magnesium, and vitamin K2, because they all work to get calcium down inside your cell, which is the ultimate cause and reflection of increased oxidative stress inside your cell. And all four of those supplements independently, Brian, have been shown to decrease all-cause mortality, decrease your chance of death from all causes. So so for people that like to supplement, I say the more the merrier, but don't find one that you think is just so great that you neglect those big four.
Well, I take NAC every day. I actually decided to manufacture my own a couple of years ago in the middle of this pandemic, so we've got it there. Now, I want to ask you a couple things about some other ones. What about, actually, just talk real quick. Let's just spend a minute. We got like 9 minutes left here now. I've got a few other things I'd love to discuss with you, and then have a little bit of time for you to talk about anything else that you might like to. This idea that I've gravitated to accept, along with you, that no one should be supplementing calcium. Would you like to elaborate on that for a minute? Because I know you absolutely speak on that very often and publish on it.
Well, I have a book. It's titled Death by Calcium. And I start by saying the title is not an exaggeration. It's very clear when you look at the data. And I mean, there's a lot of studies. This is just a few incidental studies. There's a lot of studies that show the more supplemental calcium you take, the greater your chances of heart disease and the greater your chances of dying young. It's a primary carcinogenic agent above a certain daily intake. Now, people say calcium, that's good for you. Yes, certain low level intake of calcium is absolutely essential for good health. I consider calcium, along with iron and along with copper, to be what I call the three toxic nutrients. You need them all at certain limited low levels, but above those levels, they become uniformly toxic and it partners in a great deal of pathology throughout the body. I mean, I could go on and on about that. There's a whole book's worth there. I will say this too is non-dairy sources of calcium in your diet are fine. In other words, if you have different foods that have high levels of calcium, but I'm not talking about drinking a glass of milk. That's just as bad for you as taking Tums and Rolaids, which are concentrated forms of calcium carbonate that just end up recalcifying inside your body. Once you look at that particular situation, dietary calcium is fine if it's not dietary calcium due to heavy dairy intake. You don't have to eliminate dairy intake, but as the book describes, it needs to be seriously restricted. And you should never, in my opinion, based on the data that I cite in the book, never take supplemental calcium, certainly above 100 or 200 milligrams. You'll find some supplements that some of them are in like a calcium form, and they might have 20 or 30 or 40, 50 milligrams of calcium to get the other supplement. That's okay. But when you start taking 500, 700, 1,000, 1,500, 2,000 milligrams of supplemental calcium a day, you're doing yourself serious harm. No doubt about it.
All right, so now, Dr. Levy, let's highlight a few other things. Thank you for doing that with calcium. I really appreciate that because I 100% agree. Vitamin D, you mentioned, it's one of the top big four for you, and magnesium, both of which I offer at our site also. Magnesium, I've already done multiple shows on. I actually did one show 3 years ago. It's titled 15 Diseases and Symptoms that are caused by one mineral deficiency, and it's all about magnesium. So I hammer away on that all over the time. Good. And I want you to know, Levy, this is really funny to me because you have your great book on magnesium that you recently released, I think in the last couple of years. I love it. And each week, weekly, it doesn't matter what plane I'm on, what restaurant I'm in, anywhere in the country, this is not a joke. People come up to me and go, "You're that TikTok doctor. You're the magnesium doctor I see on TikTok all the time." I hear it every week, almost daily. Some waiter, chef will walk up to me at some restaurant. "You're the TikTok celebrity doc, the magnesium doctor." Yeah, I've got magnesium hammered away. You believe in magnesium? Go read your book. What's the title of your book on magnesium?
Magnesium Reversing Disease.
Amen to that. All right, so go buy it. Everybody should have it. I have it. I've read it. I loved it. All right, now vitamin D. Let's talk about vitamin D because that's one of your big fours. What do you love about vitamin D in respect to heart health?
Well, vitamin D is somewhat unique in that too little of it will kill you and too much of it will kill you. Having said that, it's very, very difficult to take too much. So when I talk about a high side of toxicity, that's really when you're going way beyond the recommended supplemental doses of D. But I do point out, though, that there is a sweet zone, roughly, and this is by a blood test, anywhere from 60 to 80 or 90 nanogram per cc. And don't worry about those the units. That's just what it's reported on the lab. Most people, if they don't supplement, are low. Okay, even when they live in a sunny climate, a lot of people, I don't know, they think that running between their apartment and their car and from their car to their work or the grocery store and back again is somehow enough sun exposure to give them enough vitamin D. It can be done, but not many people do it. So vitamin D is a very powerful It's actually got hormone-like effects. It's probably more of a hormone than it is a vitamin. It has roles with many hundreds of different enzymes in the body that is necessary to function with. It's very anti-proliferative, meaning it helps stabilize the cells and prevent carcinogenesis from ever developing in cells. And when you get your D levels fine, also it regulates that nasty fellow called calcium. And the way that you keep your calcium levels really normal inside your body is by keeping your vitamin D levels normal. The vitamin D allows you to basically absorb the amount of calcium you need from your diet. So that's a major role that vitamin D plays, is to make sure that you get the right amount of calcium from your diet, because it plays a big role in the absorption of calcium. It gives strong bones. Vitamin D is very important in preventing and minimizing osteoporosis, whereas we mentioned about calcium has no effect on osteoporosis at all. Okay, the big myth, but vitamin D does. And so we'll also see a powerful anti-infection protection with vitamin D. When you keep your vitamin D levels in the normal range I just talked about, 60 to 80 or 90 nanogram per cc, you are giving a major support to your immune system to not even contract infections to begin with.
So I want to quote a study on vitamin D3 that was done by the University of Leeds. It's a 5-year study. I'm going to read it. The ejection fraction of a healthy person is usually between 60 and 70%. In heart failure patients, the ejection fraction is often significantly impaired. In the patients enrolled in the Vindicate study, the average ejection fraction was at 26%. In the 80 patients who took vitamin D3, the heart's pumping function improved from 26% to 34%. In the others who took the placebo, there was no change in cardiac function.
That's a big change.
It is a big change. So sunlight, you actually recommend more sunlight than from the apartment to the car?
Yes, it'd be a good idea.
You're in Miami. They should be spending how much time out in the sun, do you think, per day? How much?
Oh, well, if you go to the bright hours, I mean, without sunscreen, probably no more than 20 or 30 minutes. I mean, it's something along those lines, but it's not a well-defined science as for a given person. So somebody needs to get their baseline blood level, do some supplementation, and repeat the blood test down the road. Now, it's not something they need to compulsively check all the time. I mean, basically, if you have a certain low level and you get on 5 to 10,000 units a day, somewhere in between, and then you're in the normal range 6 months later, well, you don't need to keep repeating it, okay? But it's important to be documented at a certain point in time that your supplementation or your routine in the sun, whatever it might be, is keeping your vitamin D level in the normal range.
Amen to that. All right, so Dr. Levy, we've got about 40 seconds left here. All right, so I just want to kind of summarize some things here. We talked about vitamin D, magnesium, reducing supplementation of calcium, and your other concerns about iron and copper, I know. I just want the audiences to know we have NAC that's available at the Dr. Ardis Show. Our goal is to put in the hands of people information, education, publishing research like you do that help to summarize confidence in people that they can apply basic supplements, dietary changes to improve their health. One thing you did not mention in this entire show was a single drug to address any heart concerns that we've discussed here so far, which I really appreciate, even with elevated troponins. You mentioned vitamin C. You mentioned magnesium, vitamin D, vitamin K. I mean, this is what you mentioned. And that's one of the things I respect the most about you is your respect and your research and audacity to publish and make sense for people the reality behind the miraculous power of nature when applied to a natural organism like us and the heart that we have. Please remind the audiences of your website and invite them here. Invite them to actually participate in your event on Sunday.
Yes, it's simple website, peakenergy.com, peakenergy.com. And the first thing that shows up on that website is a pop-up where, if you're interested, you can get more information on my workshop. People have been asking me for years to just try to put out this body of information, and people are saying, where can I get somebody to be treated by how you profess things to be? And that's what I'm trying to do. I'm trying to train docs, or at least make them aware of my protocols and why the protocols are special. So that's why it's a 6-hour workshop. But even if you can't attend the whole workshop live, it's still the recording is still provided for you as well, even if you can't sit still during those particular 6 hours next Sunday.
Well, Dr. Levy, thank you for your time here, and thanks for all you do, and continue the great work of publishing, printing, and speaking and educating. I really appreciate all you do. I'm Dr. Ardis. This is Dr. Ardis Show. This is the February month of Heart Health Awareness. We're trying to bring relevant information to improve your life and the hearts of those you love. All right, we're out. We'll see you next week.
Disclaimer. Please note, the following presentation is solely for informational purposes and should not be seen as a replacement for advice provided by your physician. It is important not to rely on the information from this presentation for diagnosis, treatment, medication prescription, or any other form of medical care. Always consult with your physician or healthcare professionals before taking any medication, nutritional supplement, herbal remedy, homeopathic treatment, or pursuing any health-related procedure. If you have a medical condition or believe you might have one, promptly contact your healthcare provider. Do not disregard professional medical advice or delay seeking it based on this presentation's information as the products or services purchased from it do not establish a doctor-patient relationship between you and any affiliated physicians. Statements about dietary supplements have not been evaluated by the Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent any disease.